Today we are coming to discuss a very interesting topic, but before we start, we want to give a big thanks to the Almighty God for making today a success. And we want to thank our mama, the visionary of PCTV Health Talk Show, Mama Benes Ajiman Prempe. We say God richly bless you. And we want to say a very bigger thank you to our Papa, let's take Papa, Mr. Benjamin Ajiman Prempe. We say God richly bless you. As you've joined today, the topic is going to be very interesting. So I would want you to share the link, follow, tell a friend to tell another friend that PCTV Health Talk Show is showing. The person should join so that the person will learn a lot about health. Here, we discuss a lot of health issue. We let you know what health condition it's going on, how to take care of yourself, and how to prevent health condition as well. So today, stay glued to your seat. Do not change the dial. Listen to Health Talk Show. We'll be right in a few minutes. Right back in a few minutes. As I said earlier, we are coming to have a very interesting discussion. And we are coming to discuss today about mental illness. Yes, I know you've heard a lot about mental health illness, and it is a very big health concern going on. And you don't really know what mental health illness is. So today, we have in our midst a mental health nurse specialist. And then she is also the head of the mental health unit of Urban Health Hospital in Tema. In our midst today, we have Mrs. Dorothy ATTUAH-ASANTE. Mrs. Dorothy, welcome to PCTV, and thank you for honoring our invitation.
Thank you too for inviting me.
Thank you so much, and we thank you for the good work you are doing at Urban Health Hospital. God richly bless you.
Amen.
And we urge you to continue to do the good work.
Yeah, by the grace of God to be able to do that.
We thank God. So, we are coming to discuss mental illness.
Yes.
And we all know it is a very bigger health concern. People don't really know much about it, but they've heard about it. So could you please take us through what really mental health illness is?
Okay, thank you for the question. And good afternoon to our listeners out there. We are talking about mental illness, that is the causes of mental illness. So when we talk about mental illness, I'll go in the three direct.
Sure.
Yɛka sɛ obi wɔ adwene mu yare a ɛno kyerɛ sɛ nipa no yɛ obi a ɔne nneɛma a ɛrekɔ so wɔ ne honam mu no ɛnni twaka biara.
Yeah.
Ana afei saa nipa no nso ntumi nyɛ n'adwuma sɛdeɛ ɛwɔ sɛ ɔyɛ no. Ɔntumi nhwɛ n'abrabɔ so sɛdeɛ ɛwɔ sɛ ɔhwɛ no. Ɔntumi ne nipa nni nkitahodie sɛdeɛ ɛwɔ sɛ ɔdi. Ana afei deɛ twa toɔ no koraa sɛ ɔntumi nyɛ biribi mmoa community na anaasɛ baabi a ɔwɔ anaa adwuma a ɔyɛ no. So menyɛ biribi mmoa wɔn. Nti ɛba saa na kyerɛ sɛ adwene no ho atɔ kyema. Ɛno ne adwene mu yareɛ.
Okay. That's very, very, very interesting. So, Ceciano, you per se you important ne sa adwemu yare ne ba. The important, what really brings about mental health illness, like the causes of mental health illness. Could you please take us through that?
Thank you for the question. If you want to talk about causes of mental illness, it will take a whole day. But we'll talk briefly about it. Enema bɛn na de adwemu yare ba. De edi kan no. Nhwehwɛmu ama yɛ hu sɛ adekora pɔtea a de adwemu yare ba no yɛnhyɛ da nim. Na mmom adwemu yare no bi hɔ a efiri abusua mu.
That's
so
genetics.
It's genetics
Okay.
or hereditary.
Okay.
it is inherited from the family. Enti efri abusua mu na de eta efri abusua nim no ye adwom yare eta friend is schizophrenia.
Okay.
Schizo, simple term, you can schizo. And as a postpartum depression, I watch it adwom yare. And also ye yare a free abusua mu.
I see.
Afe ye ye abusua ni free ho a adwom yare etumi ba wa bra obi enya head on collision. You can head on collision to say a footballer see. Tembia ordinity pim ball ordinity pim obi.
Okay.
Enti ebra empedodo adwene nya sa impact no etumi kofa adwene yare ba ana obi so nya accident na se niti ebo ho a otumi enya adwene yare echu.
Okay.
Afi hereditary ni yenhwe twin birth.
Okay.
Se me ebia me wa adwene yare ana ma won tafo a the possibility say me mani benya adwene yare ni bi no eye 40%. Enti no direct contact as a parent no.
Okay.
Enti enkwala ni betumi enye bi.
Okay.
But say me baba akunya na ba akunu nso nyaaya possibility say ono nso betumi enya sa adwemu yare no eye 15%.
Okay, enti akoye no to say to say senya your family history of hypertension, family history of diabetes bisa no.
Yes.
Okay.
And also to me your family history.
Okay.
And I yenhwe general population. See if a general population na yes 1% ewo adwemu yare. Nti say if a nipa 10 gina definitely emu baako ewo adwemu yare. Nti courses na ye to aso niema eje adwemu yare.
Okay, so yenka say basically head injury ebi obi enya accident nipa ni diniti ahwe honom anase obi aslepe papatre no abo form na niti abo ho that can predispose the person to having mental illness.
Yes,
okay, and then family history.
Yes.
Okay, so let's say if your mother, your father, your grandmother or an uncle in the family has a mental illness, there's a possibility that you can have mental illness.
Yes, the possibility is there, but it doesn't mean you will have it.
Okay.
Sometimes you have to be predisposed.
I see.
So when we talk about the predisposition,
like
we
what?
don't talk about doing drugs.
Okay, so let's talk about what predisposes us to having mental health or condition. Let's say the person doesn't have a family history of mental health. No one in the family has mental health, but the person ends up having mental health condition.
Okay.
So what really predisposes one to have mental health condition?
All right, and then my predisposition and I draw so the kind of and sanum.
That's alcohol. Taking alcohol.
Better me a predisposition. Drug abuse. They say be a heroin, the hard drugs.
Sure.
Heroin, cocaine, cannabis, those things, and also better me a predisposition. Marital challenges.
Okay.
Better me a predisposition be into getting mental illness. Say be a how be abuse anymore. Or my can be man say be a person jan. Leading to the kind of broken heart.
Okay.
It is sad and so a bit me a predisposition will be into getting mental illness. And a marital problem say nipanon to mingo.
Okay.
Nipano a worry, but I didn't feel be brewing to mingo. Pressures from family, pressure from husband, and even the pressures from outside. A bit me a predisposition nipano. I'm an mental.
Okay, so let's say basically if somebody is going through a life challenges like what you have really mentioned, like somebody is going through life challenges like the person is married, the person is not giving birth, the person is going through financial challenges, the person is over 40 years and the person is not married. And the family is giving the person too much problem, the person start thinking and all of that. The person can actually have mental health condition even if the person doesn't have a family history of mental health condition.
It's possible. And even work layoffs when you've been sacked from work.
That's nice. So viewers,
lead you to mental illness.
viewers, I'm learning a lot today, and I hope you are also learning a lot today. Let's be mindful of certain things that our specialist is mentioning. We have to be very mindful and take good care of ourselves, because as she said, it's not only family history. If there is somebody in your family that has mental health, that means you can have mental health problems in future or something. But our lifestyle, what we go through in our daily lives can actually predispose us to a mental health problem. So we have to be very mindful and take good care of ourselves. So Auntie Dorothy, let's continue as you were taking us through.
Okay. And the childhood mental health conditions. And Kolani bi oha usano ye abuse him. Whether it's rape, physical abuse, verbal abuse. Enti onyinia. Sa feedback na onya no kwalabre mu timi predispose no into mental illness or experience bi ma. Itimi maninya adwemu yare. Eno no your friend post traumatic stress syndrome.
Okay.
Stress disorder.
Okay.
Yes. Inti enema bi a ato pain no. Se ebisi bi ma itimi ma etwe okwa etwe ma okondwendwe. E ma na predispose into mental.
So does it mean if, let's say, somebody is being attacked by an armed robber or something like that, the person should be taken to see a specialist, like a mental health specialist, so that the person will be spoken to?
Yes, when something like that happens, some people don't experience anything.
Okay.
But if a person is there and maybe is sleeping and is having flashbacks of what has happened, and the person is shouting, hey, the people are here again, they are coming to attack me, they are doing this, then the person needs help.
Okay.
We have to get help for that person so that that situation can be resolved for that person.
Very nice. Viewers, I'm learning a lot things today. So Auntie Dorothy, so what is the signs and symptoms that shows that this person is having a mental health problem, or this person is showing something that needs to go and see a mental health specialist? What's the signs and symptoms in somebody?
Before we go into the signs and symptoms, I want to talk about something else.
Okay.
May is Purple Month.
Sure.
And when we say Purple Month, it's mental health awareness creation.
Beautiful.
And the awareness creation this year, we are turning awareness into action.
Sure.
That is why we are moving about talking to people about mental health. So now our main focus is maternal health. So have you heard that some people experience mental illness after delivery?
I've heard, I've seen, and I know it is very real. So I think viewers, you should support your wives, your sisters who are pregnant and they are going to give birth, so that even when they go to labor with a lot of trauma, a lot of family pressure and all of that, I think that can also cause that. So let's give them support when they are going to give birth, so that it will also help to prevent those conditions.
So I want to say that postpartum psychosis and depression is very real. It's happening all over us. But in the beginning, we think they are spiritual. So we roam. By the time we get to the hospital, it's too late. But it's actually treatable. If it's seen early and treated, the women can go back into their normal lives as they were before they got pregnant. Thank you.
Interesting. Viewers, please, if you have any questions to ask, you can bring your questions into the comment section. Please share the link, follow, tell a friend to tell another friend that we are discussing about mental health illness, and the person should tune in, because I'm actually learning a lot of things, and you can also learn a lot of things. Mental health condition is by hereditary, not only hereditary, but then our lifestyle can predispose us to mental health condition. As our nurse said, smoking, substance abuse, smoking, drinking alcohol can lead to mental health. Pressures from family can lead to mental health. So let's be mindful and take good care of ourselves. Bring your questions, let's discuss. We'll go on a brief commercial break. We'll be right back.
Many swadium was soon film. Men we japa eja. Eja ni si wanim say. The Jan is si wanim si ket bi ekuta wonsem bi ato janim. Why ya so bedum janu ntumi num nya no. Ti many swadium was soon film say sika pa beton se. Na wa mo mpa so obedi de kasa eka betwa ho hia. Eka na ma hwe ena mehu so obi te ho. Nipa no ho adwene ba ni tima na afrim. Nipa no ni ga na wa brochire. Nipa no wa brocho ni ga na. Ho adwene si ni tima na ho adwene free tim. Obi wa brocho pese opoa wo. E wo sunsumo wi ase ade amani hwe ni. Ba o ma mpa bu mu anya dia. O na no hye obu e bosa na ba no ba kokre we bebem. Emem.
Bon se merade. Bon se
Ba kokre we bebem. Ba kokre we bebem. No wan sa mo mpa ya ade bi adon sa be somso bi aso ntim fa nkwa wie.
Bon se merade. Bon se enoso no kwepa.
Last year no kam person mu ni go ye ne yarefo. Ti last year yare ampa ni tu so. O yare pa. Na nke wo se wo nyame na je no.
Back to PCTV Health Talk Show. We are talking about mental illness, and we have Mrs. Dorothy ATTUAH-ASANTE in the house. So, Mrs. Dorothy, as we were discussing the signs and symptoms, could you please take us through?
Okay. So, if you signs and symptoms, I know you, and they are bang, and any pana or what you may or better than it. They did kind, and they are more tired than a deeper, and they say, or better than a free nipem. That is isolation.
Okay.
Or experience challenges now, or training who free nipem. So when we say be a nipano, no, you'll be a huna, or a lively, or no be a dim common, no be a casa. But they say our bar, and our huna, who was our trainer, as what in a one corner be, on pursue be a becassa. Pursue be a dinner bon common, and no ye back. After they neglect their personality.
Okay.
Yes. And no, or sorry, our own diary, own training say, on CC no, on dressing it, on your tree. Obe can say, oh, sister, I dare uncle Jarry or see me Jarry, and so now Otihono. The next symptom is that they have hallucinations.
Okay, can you break it down for us?
Ni tintini ni tete anyina say almost tete eni wo masum. Oti ni bi wona suma wa ojina ne nchen wonte. Eno ye visual hallucination. Ohuni wona auditory hallucination. Oti ni wona sum. Ana ohuni pa e wona ni so. Obi timi ka say omo ba ompese ombe kume, ompese omo be chime, ompese omo yem say eno ye visual. Ohuni wo ni so. Obi so ha oti se eniema ne nam ne body. As an anti some insects are crawling on the body. And no tactile hallucinations.
Okay.
And no your body. And no be only part say and 30.
I see.
They see all these things in their hallucination aspect. They also have delusions. They can't delusions believing in something that is not a false belief.
Okay.
Enti obi to make us nyame. Oni abofo di nkomo.
Yeah.
Yes, nyame aka kire ni say onka say entro, but me wa onim nipa no. That is not how the person is.
Yeah.
Obi to me hu dua ana dia buda, obi to me aka kire so hu ni say wo. Meanwhile, you don't see like that. That is delusions. And obi so to me e bone hu abunfia. Many are persecutory delusions. Obuni hu for. Ebia officer name maybe horse and call ye went to me and ye. The time be a bunny who abunfia a bunny hu for.
Okay.
Because of what is happening. Afi hallucinations need delusions in if you are. And no nabama who say ni panic to her no cassatreno. Obi antin but as no be bonkomo, a cassa, a sre. Obi crati me to her no sorry no to Mrika. Wabra be any nature but or see obi etan. Nina signs and symptoms.
Okay.
Obi to me ne for ne busia cra a try on kufa.
Okay.
Because of Felice or more kind of himself. in the sense that obi a wadwum yare say yemi enu yete hai ana ye di nkomo ana sewe bibem na nipa ne pie free ha prekopa obaka say ye ka ne ho asem because obi ha na ye sere nti ne ho asem na ye ka nti na ye sere nti omo hu niema bebre afa dia agye nsem kra ne ebra nipa na woro ne ho a wate esi abonten no eno ena agye nsem.
Okay, so
afa symptom ne bi so yo say obi o ha won didi on didi o sorry a on pese obi didi obi nso ho a obi didi obi nso ha on to me na kra obi nso betimi ada abro so more than 12 hours 14 hours no order unya ne na kra on pese obi
sorry.
yes.
Okay, so basically some of these things are looks like some are lifestyle though, and we would not even relate it to mental illness because talking about obi wa ha shohana or hana access on person be biom not shedding, you know, sometimes it's a daily life where you would think say nipa no maybe the person wants to be alone, maybe the person is having some issues and the person wants to think about his or herself and be alone. So things like this, sometimes we don't really relate it to mental illness.
Okay.
So does it mean that say oh maybe another I say for a while now the person is withdrawn na or shedding usually you people come together and have maybe meetings and talk, but all of a sudden no more friend on person beba or shedding, like should it be something? So it means it's something that you have to be concerned about.
Yes, we all have mood swings. Mood swings ya debia obia obi. As a torebia so home waba person obia bekasa. And there are sometimes really you want to be alone to think about situations. But in the extreme, Yanshan is any panel, watching who about 2 weeks. Or shadem or no be ankasa or no kwa casano crown few and akasano on fan and non jiso. No dignity and able. That means there is a problem. Okay, will be, but when it goes to the extreme, 2 weeks and after, the person will have to seek help.
Okay, so there's another one that you said, say, obi woha, e woha na eyene say obi kan no ho asem. So betwe na 1 or 2 people to honom no mokasa. Na eyene say obi kan no ho asem. You know, and then these things are our daily lives. Yeah. You know, like our daily lives are in fact say oti compound house and oti baby anchor forward or oti baby you've had 1 or 2 issues with people. Yeah. Na trim na inkrofone kasa. It's normal for you to think say bia omo kan once, but to which extent do we say this person has mental illness? Because that thing is a daily life something. If I live somewhere and I've had a misunderstanding with 1 or 2 people and I see that they are talking, anytime I pass and I see them, my mind is, these people are talking about me. Whatever they are talking about, I don't know, but my mind is, these people are talking about me. So to which extent would we have to be worried that this person is developing a mental illness?
Okay, thank you for the question. As human as we all have challenges. Until you know be a and until we trim and we feel say, fine, that's okay. But the answer in the aspect say, oh, wait, you mean, be any issue. Uno be astray. But for some time now you've been isolated. What you want to be out? To the extent as say, "Who tremukora na uni miniasem," but make us astray cry. We say it's about you, and no, and I will say a shame because it could be say, "Oh, huniema or T voices be a train is a microphone a casafa."
Okay.
Meanwhile, only nipaniasem be but only will be was sem. Namu tramno only be casano motion. It could be said really they are talking about you. But here's the case: you don't have any issue with anybody, but you think even people you don't know are talking about you.
Yeah.
Yes, that is the extreme. That is when you have to seek for help.
Okay, so with what you have spoken about, let's say at which point we spoke about say obi kasa ohwa, the point you have to, and then you said something that there gets to a point where nipa ni beji natari na afide onam krom. That I know my viewers have seen a lot of people walking on the streets without clothes and speaking to themselves and all of that.
Yeah.
That is like ni crack
Crack,
or
that's the last end of
that's the
it.
last end.
But we should also know that mental health has no respecter of persons. From the presidency to the truck pusher in the market, everybody can experience mental illness. And mental illness doesn't mean that when I have it, definitely I have to go off my clothes and be roaming. There are some sitting in the offices who are having mental health challenges. So as I said, when there is isolation, when they are seeing things that we are not seeing, when they complain a lot about things going on of which we are not aware, we have to be prompted that no, this signal is a red signal. We have to seek help for this person.
Okay.
Sometimes when it happens, the persons themselves, they are not aware of what is happening.
I think especially with the hygiene.
Yes, they are not aware. Even them talking to themselves, they will tell you, yes, they see somebody. That is why they talk. So you may not be aware, but to us, it's a form of mental illness.
Okay.
So we shouldn't put a close eye to that at all.
Okay.
We should talk to them about it. The changes that we've seen, we should talk to them about it. If they are willing, we can seek help for them. If they are not, then relatives will have to come in to bring the person to the hospital.
Okay. Viewers, if you have a brother or a sister and you see that the person is withdrawn for some time and it's unusual of the person, please get closer and talk to the person. Maybe the person will need help, will need to see a specialist. Because basically most of the things that our specialist is telling us are things that are part of our daily life, and you wouldn't even relate it to mental illness. You would think it's normal. But today we've learned that to some extent of somebody being withdrawn, to some extent of somebody's hygiene being their hygiene not well, the person has a mental health condition. Because let's say if you have a relative, a brother or a sister who dresses well, but all of a sudden the way of dressing is bad. Onsi natare no she atarina pompon no she impabano to no left right. Making this is somebody that is fashionable. Then all of a sudden the person will be in the room and be withdrawn and opie kwabonte natare shema some style. Please get closer to that person and then seek help for that person. Because as our specialist said, it gets to, from that point, it gets to a point where the person goes out to town and the person will not come. That's when you see say we in Atari and all now. So if you see anybody like that, please seek help for that person. Auntie Dorothy,
Yes, dear.
there was something that I saw on TV, and that thing, when I listened to it, I was like, hey. And you're saying your mental health condition, Kakao.
I think I know where you are. Is it about keeping things?
Yes. So
we call it hoarding.
I saw it and I was like, he was like, some of us, the perfumes that is finished, we are still keeping the bottles, our body lotion. Me say, I saw it online. When I saw the thing now, I'm going to share my table. So, me perfume na sabot on here for me, person me to actually. My skincare, you know, I'm still keeping the bottles. Now, I feel my question is I'm saying, Papa, no can. Is the person trying to say that we have a mental health condition, Kakra? So I just looked around my room and I noticed that what the person is saying is exactly what I have done.
Okay.
Does it mean I have mental health condition?
Okay. That's an aspect of it. But let's look at the mental illness that I said is genetics, schizophrenia. They have a symptom of hoarding. You can't hoarding, and that is keeping things that are not necessary, that are not of any use, but you keep it. that is what he was talking about. But to be diagnosed as mentally ill is not only one criteria. You should meet about 4, 5, 6 of them for us to say that yes, this person is suffering from mental illness, especially the hallucinations and the delusions. So hoarding things is an aspect of us all. But sometimes when we see that we are overdoing it to the extent that now it's not normal again. Everything we buy, you want to keep it. Whether it's disposable cry, you want to keep it. Then to the extreme, then there is mental illness. That is why we are saying that too much of everything is bad.
Okay, so this is bringing me to some stigmas and misconceptions. But before we go there, there is one other thing that I also heard, like it's part of our daily life, that they say that it's also a kind of mental health condition. Like you are sleeping, you lock your door, and later on you're like, you think you didn't lock your door. That aside, you are sleeping, your curtains say what would they more for a long time. You are sleeping, when you light, then the curtain action home. Then you quickly switch on the light. I say, curtains now is some style be like, and they say that all those things are like a bit of mental health conditions, sort of. I'm like, and I say, you know, what are those things about?
Oh, okay. I think that I near ma they be a but in the most so and a day of so that one we call it obsessive compulsions.
Okay.
So obsessive compulsion disorder, OCD. And no and my yes, as a what to open once I want to me qua no sign which we bet me out running sasa 2 minutes as I want running sat no sign Nina obsessions ye but the compulsions to it that makes it a mental health issue. And it is said they were sorry and what to you were able to sleep throughout the night.
Yeah.
But those with that condition, they will not sleep. They will wake up like 8 times to check the door every time. And the curtains doing that. Sometimes they will even remove the curtains or draw it to a particular place for them to know that it is there. And they will wake up and see if it's still there.
Switch on the light to see time to time.
Yes, if
it's still there.
They hanged it, it's still there. That makes it the obsessive compulsive. But once in a while, I say a pronoun to Munama, I say tap no sisu, Baba so, then you are certain that you've closed it. But going back to it again and again and again makes it a mental health issue.
Okay, viewers, you heard it all. These are daily life things that we do, that we have the misconception that is a mental health condition and all of that. But as our specialist said, constantly doing it is when you need help. But you doing that doesn't mean you have any mental health condition. We'll go on a brief commercial break. When we come, we'll talk about stigmas and misconception about mental health.
You have 2 arrow of stroke. 90 me and for one to form. Yes, I bet 2 second one. Second one at the water form. Me who say what you you're 2 way na inya, but to me and for one to form. Me who say asa to fro. Na kaya to what buff. But this time they're 2 year in there. Me said do to form. But ene only yes we see ene arrow no erade ye free. Last year obre pa when ya ni easy oni peduem we yare pa. Sika woni nsema ni timu nya dio. Sika woni nsema ni timu nya dio. Na uko free fear e ma doso ya na be yi doso. Sana ni fie tie.
Bo se be ready. Ma o se e no kura pa e ma doso pa.
It's a misasade on ni nua ma mo problem.
See eno de omona oni no wo problem.
Everybody say men kan jo say wu mate. Nyame ya memo ade ade bi abrem na ma kire wade bi na waye. Wo ho kire wo do na ho ha kakra. Aho kire gu so too much. Enipa bia do me do too so much go be disappointed.
And the crap, I'm confident.
Among doing too so much go be disappointed. It's when this was doing soon fem. A third be crying a capper crying the bino. But what is I mean, cancer, there's a restoration. Oh, there is a restoration. Oh, there is a restoration. I say there is what? A restoration.
TV Health Talk Show. So we'll read a little bit of your comments. We have Osei Nyaku Emmanuel saying that he's watching from University of Education Winneba and he's thanking us for the insight. Osei, please continue watching and you learn more than this, and thank you for watching too. So Auntie Dorothy, we thank you for coming and we are really learning. My viewers are really learning a lot today. So, as I said, the stigma and misconception of mental illness. Could you please take us through?
Okay. So, when we talk about stigma is like having a negative something on yourself that everybody shows you. So, it's like when you have mental illness, obia and person be associating with you because of your condition. But we should know that mental illness, and area aside. So when I have it and you touch me, you will not get it. It's hereditary. It runs in families. But as a friend, when I'm suffering, you come and you help me out, we are not going to contact mental illness. And there's one misconception that we have, as in the aspect that we say that every mentally ill person is aggressive, which is not true. Mentally ill patients are not aggressive. The few ones that we see that are aggressive are the ones that are out there without any help, and they are afraid of you when you are getting closer to them, and they think that as you are coming to hurt them. That's why they become aggressive towards you. But say we show them concern, we show them empathy. If you show them that you care, they will come to you for help, for food, for anything that you can provide. Some even needs just somebody to talk to about their condition. So every mentally ill person is not aggressive.
Okay.
They are not harmful. They are human beings as we are.
There you go, viewers. We shouldn't stigmatize against mental health patients. Mental health condition is not a communicable condition that when you touch the person, you also have mental health condition. Let's show them love. Let's bring them together, because showing them love can also help their recovery. Because you can imagine somebody going through some emotional traumas that have brought him or her to mental illness. This person, when you don't stigmatize the person, you bring the person closer to you, it will aid the recovery of the person. So please, we shouldn't stigmatize against them. We should always bring them together, talk to them so that they feel people care about them. So Auntie Dorothy, how is it treated? Like, what are some kind of treatment and all of that? How is it treated? Because you said it can be treated or it can be managed, or
Yes.
yeah, how is it done?
Okay. So now in the whole Ghana, we are trying to integrate mental health into our physical health. That is, we have mental health units in all hospitals in Ghana. Some polyclinics have it, some health centers too have it. So there are treatment and there are management.
Okay.
So in management, we are talking about medication
Sure.
and therapies. So we have a lot of therapy. I'll give one. We have the therapy we call CBT. CBT. It's a behavioral therapy.
Okay.
So we help the person to look back into their childhood, address their behaviors, and help them get back into the society. Some need psychotherapy. That is just counseling and telling them the way to go. Then they are fine. But some actually need medication. So medication, we have antipsychotics.
Okay.
Antipsychotics are medications we give to the mentally ill. Long-standing mental illnesses are managed. It doesn't go. So like the blood pressure, like the diabetes, they have to be on treatment for a long time. Then when we see they are doing well, we taper the treatment down. So maybe if you are taking 10 milligram, we bring it to 5 milligram. Then from there we see how we go. And some too, like the postpartum psychosis I mentioned earlier, when we see it early and we start treatment between 6 to 1 year, the person is okay with our medications and they can go back to their normal life. And we have psychotic conditions such as substance-induced psychosis.
Yeah, that's
so
the drug
those,
abuse.
yes, those taking the substances and the alcohol, when we put them on treatment and they are able to stop the substances, they go back to their normal lives and they do well.
Okay,
Some are treatable, some are manageable.
Okay, there is this question that I want to ask. Does mental illness affect children? Like we've said about genetics, that if you have a family history of mental health, there's a possibility that you can have mental health. But children, like let's say 5, 6, can they have mental illness?
Thank you for the question.
Because we've spoken about head injuries that can lead to mental illness, but I don't know, can children like actually have mental illness?
Okay. Children can have mental illnesses in the aspect of depression. We have childhood depression.
Okay.
That we often ignore. And colonial depression, especially the preschoolers.
Okay.
6 years and above. Once why depressed, why isolated, why lively, or to me agro or but once a recently maybe I watch any one finipem, Ubusana Sema or a timid class on your active on pursue obedient on to mean that. Then that means there's something going on with the child. And children born to parents who abuse drugs.
Okay.
To say obi or on your or no son or your drugs into your this alcohol condition for children.
Okay.
So when you do that, you give birth to a child who is not normal.
So like malformation of the brain, or
yes, and some even get the heart in holes.
hole in heart and all
yes,
of that.
hole in heart and all those conditions. So children do suffer mental illnesses, and the teenagers are experiencing it bad.
Okay.
From 11 to 18 years. Some are experiencing the condition, especially the schizophrenia that I talked about, that is hereditary. The early onset is 14 to 16 years.
Okay.
So some children actually suffer from mental health.
So can herbal medication treat or manage mental health, mental illness?
Okay. As I sit here, I don't have any evidence that herbal medications can be used to manage mental illness. What I know is the orthodox medications that we use. So if there is any mental illness that has been healed by any herbal medication, we don't have statistics on it. There's no evidence on it. So I don't know about that.
Okay. So what do you have to say about a spiritual belief and mental health? Like let's say somebody has, or somebody is exhibiting a mental health condition, and you know, with our misconception as Africans, and we would think that maybe the person has done something to somebody, so instead of taking the person to the hospital, they would want to take the person somewhere and all of that. Like, what do you have to say about our spiritual misconception about mental health? Just something brief for us.
Okay. coming from the medical field, yeah, they believe it's a mental illness, a general medical condition. I will say a share near Shamwasem. Your misconception about say Obia Bonibi, Intina, Adrimi Arena Banaso, and our due be bonny, and our Korea Adeno. That is to us. But no, sometimes my treatment need delay. Because I never go so many places. I never go spiritual places. I never go sorry, I never go comfort, I never go baby any kinds any panic could do. But we as health professionals, you can go to all those places, but bring the person for treatment. Then you do the spiritual aspect. Because Bible na kura ka say yemfa duano ahaban ninu bunano ensayare. Na yenhwe huhu de no so. Enti no ode ne ba na ema ne nura, you can also go and pray for the person. We don't say you can do that, you can do that too. But it's very important and very necessary for you to bring the person to the hospital for an assessment to be done, for us to know the exact condition the patient is having and give out treatment. Then you can go your spiritual way.
Viewers, you've heard it all from our specialists. Please seek medical attention, pray as well, but please do not neglect medical attention. We'll go on a brief commercial break. We'll be right back. Please bring your comments and your questions. Let's answer. We'll be right back. Welcome back to PCTV Health Talk Show. Today we've learned a lot of things, and I must say you should always join PCTV every Sunday at 4 p.m. to enjoy this education, different condition, different health topic. You should always join. Share the link. Follow PCTV so that you can enjoy all this education and be abreast of all conditions that is happening, new conditions that is coming to Ghana that you don't know. You would learn about it. So, Madam Dorothy,
Yes, yeah.
all too soon we are bringing the show to an end. And I want you to give us your final remarks and your final advice for us.
Okay.
For us with our mental illness and our mental health, a general just for us education. Thank you.
Thank you for the question. I think that my final remarks be you say mental illness no area ewo ho. Enti ye mo ye ho ban. Said be ya yenya adwemu yare. Na ye boy ho ban a what I've been preaching is about self-love. Love yourself first before you love the other person.
Okay.
because we do a ho kania na say other person ye obi bia and how baby you'll be able to forget about it. But to the rain na share the other person, you give all your love to that person. Na nipa ni disappoint you, then you have challenges. So we should practice self-love. We should think positively, and we should seek help when we have challenges. Additionally, me person make us say herbal unit. Now we are trying to bring herbal units into all government facilities.
That's great.
So that yeah, I am per se a benum abrofu aduru no. Na ye per se ye edibiduru no. Ye be ba na ya kyerɛ yɛn kwan a wo se ye fa so a ye fa no. Esan se hospital a bibiduru no de ye de afa abefo afidie mu aworo ho asone so eyi ne ma fi bi afiri mu ansa na ye de ba eno so ye be kyerɛ se de obefa no a enka wo liver ana wo kidney nti ho behia pa se abreni abrebia no ye beba hospital ni basic health. Mental health units are all over Ghana, so seek mental health and seek mental illness advice for people suffering from mental illness.
Okay.
Thank you.
Viewers, I hope you've enjoyed today's segment and you've learned a lot. Please, if you are going through any emotional problem, any emotional trauma, please seek for help. Talk to somebody. Talk to somebody. Don't be in your own shell, thinking on your own, finding solution on your own. Please speak to somebody, because our daily life and our daily activities can predispose us to mental illness without even having a genetic problem or genetic condition of mental illness. All too soon, we've brought our show to an end, and I would urge you to join us next week, Sunday, at 4 p.m. for more education. Thank you so much. See you next week. Bye.
I did be rush to hospital. I will market him to you so much a trip. Be the so much a trip. Month of March. Be the so much a trip. I will be a yacht woman if you. Atade midwife atade sunsun wi ase yi afiri ho. Ye afiri. Atade bi a obi se oma wo nse. That atade no must not come into reality as a midwife. Let that arrow go back.